Sure, I can start. My name's Ashay. I'm an MS3 right now. Clinically, I'm interested kind of between optho and ENT. Those two I'm specifically interested in because I've uh, been in like the tech development medical device space for a little while, and I've started two companies, one in each of those fields. In terms of non-traditional clinical things I'm interested in, my mind's open, but really I've always wanted to be interested in, medical devices and venture capital. So those are additions to my career that I look forward to.
Well, that's the world that we play in. So
Great.
I look forward to having a talk.
Yeah.
All right, and then Connor, you want to introduce yourself?
Hello. I don't know if my there we go. I'm Connor. I'm a MS2, and let me just adjust this a little bit. I'm not totally sure what field I'm interested in yet. I did some research and had some experiences actually with aerospace medicine this summer, and I thought that was really cool. So possibly emergency medicine, but I still don't really know about surgical versus non-surgical. And then with regards to my interest, like extra clinically, similar to Ashay, not as much technical, but like kind of the entrepreneurial space, but also I think I'm interested possibly in some kind of like healthcare journalism type experience. So I don't know, I'm still kind of figuring things out, but a lot of time to do so, which I guess is good.
Yep.
Great. And then Justin, you want to tell us about yourself?
Hi, everyone. So I'm first year, just started medical school. As far as specialty goes, I'm not really sure what I'm interested in right now. Right now, I'm kind of looking into ortho since I've always played sports, and sports is something that I want to be around for my entire life. So kind of interested in that. As far as non-clinically, similar to Ashay, I'm interested in medical devices and VC. Currently, I'm working on an NIH contract to help labs scale up their COVID-19 diagnostics, or it's labs and companies. So it's kind of like a Shark Tank for diagnostics, and we evaluate proposals that come in from companies or academia. And right now we're helping a lab in the Midwest scale up to 60,000 tests per day, and another company develop their device for the defense industry.
How are you guys doing all this company related stuff on top of medical school?
Yeah. Mount Sinai has been very supportive, actually. The ophthalmology company that I started was with 5 other medical students in my year. So in terms of, ability to make up certain curriculum, ability to get funding from Mount Sinai Innovation Partners, and like connections to the VC ecosystem in New York, it's been a great experience because there has been a lot.
I feel like an underachiever right now. I'm like, I just passed. So I guess we can just let the people kind of trickle in. I was going to introduce you, Matt, but I guess you can introduce yourself, and then we'll kind of open up to questions, because it sounds like the 3 of the students that are at least here have a lot of common interests.
Yeah, sure. So I've got a kind of complicated bio, but I did my undergrad at Cornell, graduated in 96, and then came to Mount Sinai as an MD PhD student, and did the first 2 years in medical school, and then left and went to graduate school and finished all the graduate school coursework, and had been working in the women's lab that I was in for about 4 years, because I started there in the first year of medical school. And
what did you do your PhD in?
Well, that's the thing. So my preceptor died on the Swiss Air 111 plane crash. I think it was 2000 or 2001. Yeah, it sucked because she was 37 and she was bringing her family. She had just had a baby, and so she was going back with her husband and the baby to introduce the baby to her family in Greece. She was Greek, but she was the first Howard Hughes investigator at Mount Sinai, and she came from David Baltimore's lab. So at the time, this is when Mount Sinai's basic science departments were not all that recognized. And, as much, I know so much has changed. And so, she was like a big get for Mount Sinai at the time, coming out of David Baltimore's lab. And because she was the first Howard Hughes investigator, she had, very quickly, 10 or 12 MD, PhD students in her lab when she passed away. And so the graduate school and the work that we were working on was very esoteric, immunochemistry stuff. It was the biochemistry of VDJ recombination. So it was the kind of thing that not a lot of labs in the country were working on. So the graduate school made a rule, because there were so many MD, PhD students, because there was like only 2 labs in the country, one at Stanford and one at Yale, that was doing this work. And they would have had to ship all of these students to these labs to continue their work. So the graduate school made a rule, said you had to be a year or less away from finishing your thesis, and they'll send you to the other labs. Unfortunately, I was still a couple of years away, so I would have had to start my PhD work over from day one, which, as you guys know, it's, anywhere 5 to 7 years. I had already been at Mount Sinai for 4 years at that point. I had still 2 more years of medical school to finish. So I said, screw it. I left the program and went to finish medical school. And I really never had any intention of practicing clinical medicine. I wanted to be a scientist until I learned what the science, what the career is like as a scientist, and not fun. The problem with science as a career is that you have to get lucky and be in the right space at the right time, and be in a lab and, publish something in Science or Nature or whatever. The success in science is not based on who's smartest and who works the hardest. There's too many other factors at play. And for every 20 postdocs, or maybe even 50, there's one assistant professor position somewhere. So anyways, I decided, after all those years in science, I didn't really want to be a scientist either. But I finished medical school and said, okay, I didn't really like internal medicine, but I liked working with my hands. Went into surgery, did a surgery residency at NYU, and then left and decided to go to Wall Street, because the residency just solidified my belief that I didn't really want to be a clinician as a career. So
how many years in residency did you do?
I think I left in my 5th sometime. So it was pretty
so you were
far along.
almost done. Yeah.
Almost done. Yeah. But I hated it the whole way
Yeah.
along. I give this story sometimes where there's there's a lot of stories. I did like Alexis, I did my surgery residency at NYU, and in early 2000s, it was a rough place to do a surgery residency. I remember it was just like during 3rd year, and we would get our assignments for the OR for the day. And this is at Bellevue. And at the time, Bellevue 3rd year residents were doing the surgeries, with very little from the attending, which doesn't happen anymore either. And I remember getting my schedule, and it had like 5 colon resections on it or something. And normally you'd be excited as a 3rd year resident. You're going to do all these colon resections with very little attendings around. But I was like, shit, I'm going to be here until 10 o'clock tonight. And like, that's all I was thinking about, and realized I didn't really like operating enough to make all the sacrifices worth it. So, and I have tons of stories, but I don't want to poison anybody's operations either.
Justin's like, maybe I should just leave medical school now.
Yeah, no. Hey, look, if you love operating or love being a doctor, so much that it makes all the sacrifices worth it, then all the power to you. But, the hard part for all of us is that you don't really learn who you are and what you want as a career and out of your life as a human being until you're at the point when you've already made all these decisions already, right?
Yeah, that's true.
So, the hard part and the part that takes guts is making those shifts when you really, and luckily at the time I didn't have a family. I could make shifts pretty seamlessly. And so I shifted to Wall Street, and, I thought that was a golden place to go. And I was an analyst on the buy side. Not that you know what buy side and sell side is. Buy side.
How did you do it though without having any sort of like business background?
The Wall Street is looking for folks that come out of academia quite
Just
a
with
bit, right?
expertise, I mean.
Yeah, you just have to be willing to start at entry level, start from
Mhm.
scratch, which is what you're doing, and not be so ego driven about your medical degree or your residency, and just be willing to start and learn something new. And and being it. Go ahead.
I just somewhat of an associated question. Because I think, it's been something, thinking about VC and thinking about PE and some of these other Wall Street related pathways. Is your rise faster even though you start at an analyst level? If you come with graduate degrees or domain expertise, if you become kind of like that domain expert for the bank or whoever, that firm. Or is it
I would.
like your MBA or as your bachelor's person coming into an IB position?
Right. By the way, anybody who's got a doctorate degree, a graduate degree already, MBA is just a complete waste of time. Anybody who points you in that direction it's just pointless. But anyway, that's a whole nother discussion. I wouldn't say the rise is faster, but you certainly have a leg up over everybody else for the rest of your career. And that comes in particularly into play into the career I'm in now. So let's kind of get through all this. So being an analyst was nice, but it's very dry, it's very technical, and it's not really what I was looking for in a career. And just to kind of jump forward a few steps, so the agency I founded, LifeSite Communications, is, we're more of a consultancy, an advisor, but we do public relations, corporate communications, marketing, advertising, social, creative, you name it, mainly for emerging biotech companies and not even biotech, emerging healthcare. And by emerging healthcare, I mean our clients are not Pfizer, Merck, Medtronic. Our clients range from private preclinical companies all the way up through, multi-billion-dollar public companies and everything in between. And I'd say 3/4 of our clients are biotech companies, and the rest are either med tech, device, diagnostics, some services sprinkled in there, and a handful of others. But what's unique about the space we're in is that these emerging companies are doing very sophisticated work, at the cutting edge of science and medicine. And so, what I find in our field is that we get to do some very sophisticated science. I probably read more scientific papers now than I did in clinical medicine. On top of being involved in high finance, because these companies are constantly raising money to the tune of hundreds of millions to billions of dollars, and we're involved in, helping coordinate those deals, and then we get to be creative because I'm doing all this science, doing high finance, but at the same time we're doing media relations, we're building websites, we're doing social media, and we're interacting with people because it's a people industry first and foremost, aside from all the technicalities. So there's very few industries where you can get those three components, right? The high science, high medicine, high finance, and creative, and being a people-driven industry in one place. And, for example, being an analyst, you get two of those three. You get the high science, you get the high finance, but you don't get the creative angle. You don't get the people angle of it. So that's what drew me to the industry I'm in now. And I spent many years kind of honing my skills at another agency before I got to the point where I had the relationships and the connections in place to found my own agency, which we started as one person, me, and in 3.5 years, we've grown incredibly fast. We're 50 employees now. We work with just about 70 different companies, and growing at like 100% per year kind of rate, which is kind of fun. And as part of our team, we have 15 people with backgrounds like mine, meaning out of academia. We have 15 MDs and PhDs as part of our team, 3 MDs and the rest are PhDs that come out of science. And the reason this matters, and there's no other agencies like ours that have this many scientists, and we have our own little like academic department we have going. And the reason this has mattered and really driven our growth in the field that we're in is because these emerging companies are looking to engage with very sophisticated audiences, because that's what we do as a communications agency. We help companies communicate and engage with their audiences, their stakeholders. And for emerging companies, the stakeholders are institutional investors. And I know the term institutional investor may not mean a lot to everybody, but institutional investor is versus a private or retail investor. An institution are hedge funds, mutual funds, investment banks, you name it, right? So institutional investors, strategic partners, and by strategic partners, I mean a lot of these small companies are looking to either partner with or get acquired by a big pharma or big med tech company. So those are strategics. There's key opinion leader physicians, which control a lot of the dialogue within the spaces and the disease states that these companies work in. There's advocacy groups that help these companies, particularly the ones in rare diseases, recruit patients for their clinical trial and promote disease awareness in those disease states. Clinical trial investigators. But if you take all of those audiences as a whole, they're very sophisticated. These are not lay people. And these, the companies that we work with are development stage companies. These are not, they're not on the market with Lipitor or, Cialis. And so these sophisticated audiences require a firm that can understand their science, the medicine, the data, all the technicalities, to be able to really support them at a strategic level to communicate with audiences of that level of sophistication. So, that's really what's separated us as an agency, having all these doctors and former academics as part of our team, because it allows us to understand their science and their medicine at a high level. I mean, we even had a company, is a really well-known gene therapy company too. I mean, not well-known to you guys, but in the industry, multi-billion-dollar gene therapy company, ask our team to write one of their scientific abstracts. There's no PR agencies on the planet that's writing their clients' scientific abstracts, but that's the level to which we integrate with these companies and their executives. And what's cool about working with the emerging companies is they're still relatively small. And even though emerging and startup in biotech and med tech is different than in tech, you hear of a startup and think of somebody like tinkering in their garage, but early stage biotech companies have already had, tens, if not hundreds of millions of dollars investment by the time they're, coming to us. But the companies are still relatively small. And so we're interacting with the C-level executives, the CEOs, the CMOs, the chief medical officers, the chief science officers, the chief financial officers. And they really turned to us for guidance and counsel, which is kind of cool. So that's like a general synopsis. I'm happy to get into any of these elements or components in more detail to help you understand what we do, but I'm happy to open it up for questions.
The question. So you were at an agency before this that had very similar makeup of the employees, or is yours like much more doctors and scientists and stuff?
Yeah, it was, the agency I worked at before was much smaller than what we've turned into now. So I left them and built a competitor and beat the crap out of them, which is kind of cool. But yeah, I mean, they had a couple folks, 1 or 2 in addition to me out of academia, but it wasn't, we took it to the next level essentially, but their client base was similar. And what I recognized was the need that if we really understood the science, man, we could be better than everyone else at helping guide these companies. So yeah, it was a good place to learn of what works and what doesn't and how to be better, which is what you really need to do before you launch any, agency or company of your own. So
yeah. I think someone else has a question. Yeah.
So would you say that like the biggest role that like going to med school specifically had was teaching you just like the language to understand and to be able to communicate, and then kind of help and understand. And then you obviously develop the business acumen after the fact to where you could straddle between the two worlds. So that, and then also like, do you think you could have done this, built this same company or operated in the same space without having gone to med school at all, but maybe done like a master's or just like become really familiar with the academic side of things some other way?
Yeah, so I want to come back to the individual questions because that reminded me of an earlier question about from Ashay about career path and development. You know, so it again, just like when I went to Wall Street, when I first went into this field, I was starting from scratch. I started from ground level as an, you know, relatively entry level person, independent of all that experience and education. But what I can say is my background was unlike 99.9% of people's background in my industry, which gave me and others like me a leg up and ahead of everyone else. So, you know, put me in a position of always being able to do a better job than the next person, which is, that's a great position to be in any field. Now, you know, more specifically, yeah, you know, I think that I would not be where I am today without not just the medical degree, but, you know, my residency experiences were important because it's hard to explain. It's kind of like when you've been through boot camp, you know, you kind of mature quite a lot, and going through residency is like going through boot camp, you know, times 100. So yeah, residency allows your academic education to be applied in real life with real people, and that changes your level of understanding of patients and medicine and diseases quite significantly. So, but I don't think I'd be where I am today without that background. It doesn't mean you couldn't be, but it certainly helped. And I had to learn a lot from scratch about the business world, about the communications, PR, marketing, you know, social. I'm still learning about social media, right? I had to learn all that from scratch, and it took a lot of hard work. And I think it was the hard work that I learned to put in during school and during residency that, you know, I just worked harder than everyone else. I would hear something new for the first time. You know, what's an IPO quiet period? I would go home and I would read everything I possibly could. I would call everyone the next day I would come back to the office being the expert on IPO quiet periods. And that kind of work ethic we all have to have, because it's how we got where we are, whether it's medical school or through residency or whatnot. So yeah, I mean, I hope that, Connor, I hope that answers your question.
I think so. The way I understood what you're saying is that, like, and I feel like this is kind of relatable even in the obviously much more limited experience I've had, is just the process of like going through and learning having the experiences, doing clinical research, just being in the ER, being in the OR as you're doing a residency. You just kind of get a sense of how things practically function, so that A, not only can you relate to the other doctors that you're working with down the line, but B, you just have like a fairly practical understanding of the process. And I'm sure you also just develop problem solving skills along the way, and like interesting perspectives that were born out of like looking at, I don't know, public health problems or like the emerging diseases. So I'm sure it's probably hard to exactly translate, but I think I hopefully get a sense of what you're saying.
Yeah, but it does translate. You know, we have one of the women on our team was a pediatrician by training. She completed her pediatrics residency and then didn't want to practice and came to us. And, you know, one of the clients we work with is developing a treatment for rare neuroendocrine disorders. And her ability to talk with the management team of the company about the patients, their families, it puts her in a position to have a discussion at a level most people in our industry, almost everyone in our industry, is incapable of having. And that only comes with having that experience of understanding the diseases, their patients, the physiology, the pathophysiology, and whatnot. So,
you mean the business people can't have the conversations with the academic scientists, or?
No. The people running the companies know these disease spaces backwards and forwards. Obviously, I'm talking about other professionals in my industry, in our field. And I don't want to put them down, because you don't need an MD or a PhD to be successful in this field. It just gives you a leg up.
So I guess going off of that idea of not necessarily needing an MD or PhD for some of these functions, what portion, or does any portion of your medical school training or residency ever feel like a sunk cost at any point in your career path when you switched out of clinical or medicine or academia? How do you deal with that mentally, financially, even, because medical school, is expensive? Just
Yep.
Yeah.
Yeah, not a single ounce of sunk cost. Nope.
Okay.
Nope. I use every bit of that to be successful at what we do now. Every bit of it, and not just the medical training. My graduate school in science education kind of, it was unique that I had both of those together. But yeah, I mean, I'm using those every single day, and how you deal with it mentally. You have to follow the path that's going to make you happy, and if that requires some sacrifices at some point, then you have to accept that, essentially. And there are sacrifices. Yeah, financially, yeah, I took a huge pay cut when I moved careers. I mean, a massive one, but luckily at the time I didn't have a family or house payments. It was good timing to be able to do that. Could I do that today? I have 3 kids and a house and all. Could I do that today? I don't know. Maybe not. But that, that's everybody's individual decisions. But you're weighing your career happiness against that too. So.
Yeah. How do
You were looking
Sorry, I'm hogging the questions.
No, go ahead.
I was just gonna say, how do other people in coming in as an MD or an academic, how do people in the business world, whether it's PR, whether it's Wall Street, how do they perceive you? Do you have to kind of build credibility? Like how is that process about becoming a credible business person, as well as obviously being a credible physician and scientist?
Yeah, well, the business world is run by relationships, and
Right.
Building credibility involves building relationships with the folks that you're working with on a day-to-day basis. And particularly in the emerging healthcare space, whether it's medtech, devices, biotech, all of the executives in these companies are serial entrepreneurs, and the serial entrepreneurs in these companies are funded by a set of venture capitalists that everyone knows. I mean, it's kind of a small world. Everyone knows each other, and over time, you work with a CEO at company X, and that company either fails, like most of them do, or they get acquired or something. We just had a company acquired yesterday for $21 billion, which is nice. Immunomedics, big feather in our cap. It's cool to get a company acquired for $21 billion, even though we actually lose a client out of it, which stinks, but good for them. But that the CEO of that company is going to be CEO of another company. I promise you, eventually. They all are. They're obsessed and with the entrepreneurial world, and so the relationship that we built with that company, the success that they had, when he's with a new company, who do you think he's coming to? He's calling me. He's calling our agency first. So the credibility building has nothing to do with the background necessarily. It's how you are as a professional and how you build your own brand, let's say. And brand's not really the right word, but in the world that we're in, everyone kind of gets to know each other after a while. So
Yeah.
I see there's
When you
another
were
med
looking,
student that joined us, actually. Anastasia, do you want to just introduce yourself briefly and what you're interested in?
Hi. Hi, I'm Anastasia. I'm a fourth year, and I'm going to be doing anesthesia upon graduation. But I have a good sense that, you know, perhaps it's not going to be like the only career thing that I'm going to do. And I am interested in all sorts of, you know, like businessy side of medicine as well. So, and that's why I'm here.
Good.
Yeah.
Yeah. Well, look, there's a lot of in common paths that folks out of academia, and I include people from science and people from medicine in that bucket. And the common career paths you know outside of medicine are, you know, you go to Wall Street to be either an analyst or an investment banker, or you go to the, you know, private side, you go into VC or, you know, PE, and you know, that world is not all it sounds like it is. You know, I'm happy to talk with any of you individually about those worlds. There's consulting, which, you know, will lure folks out of academia with fairly hefty salaries. You know, and there's pharma, of course, and big agency marketing and advertising stuff, meaning for the big pharma companies, right? Those are the paths most. The fact is, there's a lot more opportunities than those most common paths that you hear. You know, for example, the one that I found, which is emerging company communications and PR and marketing, which is very unique. And what I would recommend is, if you're thinking about those alternative paths, is to do as much research, as much talking, find as many people as you can, because, you know, none of us are coming right out of undergrad, you know, in your early 20s and have the opportunity to try this and try that, so as much education as you can give yourself about, and this way you're going into that process saying, you know, I know what I really want to do. This has all the elements. It's going to make me happy as a career, whether that's as an ENT surgeon or, you know, as a consultant. But the more you learn about those potential pathways, the better choices you have to make. You know, considering the years that, you know, you all and I had, and we had, by the time we're trying to make those decisions. But, you know, for example, I've trained a lot of people over the years that came out of academia, both PhDs and MDs. And I know now the qualities that it takes to be successful in our field. It's easy. It's three. And this is what we're looking for when we're interviewing folks. First of all, I want to see folks that have done their research and know this is what we want to do. Because you think about the amount of effort it takes for us as an agency to train people that know nothing about what we do. But by the way, all the folks that come out of academia are picking it up within months, right? Which normally take people years to learn this work. But the three qualities that are critically important is the ability to multitask, which is less of a bar for folks that come out of medicine than it is for folks that come out of PhD programs, because PhDs are kind of working on one thing in one lab for 4, 5, 6 years. And in the agency world and in the business world, you're juggling 100 balls at one time. And there's things just coming at you from all directions. And you have to really be good and enjoy it, this hyper multitasking. Now, for us in medicine, we're trained to do that, right? You're handling 100 patients at a time, overnight calls, 10 beepers on your, I don't know if you guys still use beepers, but, you know, 10 beepers on your waistband.
Yikes, you're dating yourself.
I know, I'm sorry. Okay. But yeah, so quality one, ability and an enjoyment of a hyper multitasking environment. Second is an ability to be a confident communicator. And this ends up being, you know, it's hard to find folks coming out of science and med. Now, Sinai is different, right? Because Sinai is very focused on humanities, on communication, on you know, dealing with the patient as a whole, than some institutions. But for the most part, it's hard to find folks coming out of science and medicine that are good, competent communicators that could get on the phone with the CEO of a company, not be intimidated, and speak with a certain amount of confidence. But connected to that is an ability to form relationships with people, because as I said before, aside from all the science and the finance and the business, this is a people-driven industry, because as I said, it's the people are doing the hiring, and people like to work with people they like. And so no matter how good we are at all the technicals, we have to form relationships with our clients. And bonus is the fact that these executives go from company to company to company, and they end up being our clients for life. And so finding all three of those qualities in folks coming out of academia is not easy. I'm sure, I don't know if you guys have heard of Doc Jobs. Doc Jobs is well, I don't think it's called Doc Jobs anymore. I think it's called, yes, it's called Doc Jobs now. It used to be the Dropout Club, right? Now it's called Doc Jobs. Dropout Club is a horrible name, but it's a job posting website for any industry, any companies looking for folks coming out of with MDs or PhDs, and you'll find all of the industries we talked about posting jobs. I mean, is the go-to place, and so we find a lot of our academics through Doc Jobs. And for example, for a given job posting, I'll get probably between 100 and 200 resumes, all MDs and PhDs, and it's split 50-50 between MDs and PhDs mostly. And for every one of those postings, we'll usually hire one person. And partly we're hyper selective, but mainly because it's hard to find all three of those traits on top of folks that want to do the kind of work that we do. So yeah, it's a process for you and for us. And I go back to Anastasia, you missed this, right? What draws people from academia to our field? Well, it's the fact that we do high science, we do high finance, and we get to be creative at the same time. I mean, it's really cool. We have a whole creative design team, these creative graphic designers that come from the pharma industry, and they understand science really well. And we on Fridays we have weekly Teams Zoom meetings, we have daily morning Teams Zoom meetings, but on Fridays we go over the creative work and the creative team, because most of us are academics and communicators and scientists, and we have this whole creative team that's doing this really cool creative design work. And it's just kind of really outside of the realm of what we all know so well. And seeing some of the creative work that this team puts together is, my jaw hits the floor. Oh my God, this stuff's amazing. And it's really cool to be around that and be around all the science at the same time. So.
Now, can I also ask you a question? You've emphasized a lot the importance of sort of making professional connections and networking, and how everybody knows everybody in the field. And I'm wondering, how do you handle any issues of integrity with the clients? For example, if you notice that one of your clients, wants to cut corners, or perhaps they have, toxic environment within their company, and if you find something like that troubling, but at the same time, you feel pressure to maintain great relationship with everybody, and sort of make sure that you're not ghosted or blacklisted by other people whom they know, or if they are an important person, they know somebody. How do you go around that, given that everybody's so connected?
That's a very good question. We have values as an organization and an agency that we live by. And no client, no amount of fee, no relationship is going to get in the way of the values that we have as an organization and as a team that we're committed to. And so there's not even a second thought there. That would not stop being a client of ours if anything like what you described was we found going on with. And that's happened. Not it's more on the business side. We find that a client recently we recognized that something was not right about the way the company was raising money. And as soon as we found that, we just cut them loose. Said, sorry, we can't work with you. And look, those kinds of people are not the ones you need to have relationships anyway. So really not a lot lost. If anything, we're risking the reputation of the agency by working with a company or an executive that's less than reputable.
Well, I'm certainly glad to know that you can have values and still be very much viable as a company. Thank you.
Oh yeah, of course. Yeah. Look, the values and the culture of the agency, there's nothing more important than that. Without the team and the values that we all believe in together, we don't have anything. We don't, we're just then a group of people doing work. It's not the point. We think of ourselves as a family. No matter how much we grow, we try and keep a very tight knit culture. And it's important to stick by those values.
Can I ask you a quick question about if you ultimately made this transition, then I assume that at some point, like throughout med school and through your residency, you had inklings of like interests in other possibly disparate like fields and maybe business, maybe like just creative or humanities, or maybe something different altogether. From someone, or for people who are, I guess, in our position as like med students, who have like obligations of, class and research and exam and like step exams, but who still have these like varied interests that span multiple fields and may or may not be like quote unquote relevant to like medicine. So a residency director may not find doing X project as valuable, but like you're still interested and want to do it. How did you, or would you recommend going about like trying out, being able to try out these different things and engage with your different interests while still being the med student and doing all the things that you're supposed to do as a med student?
That's hard, but and I'm not really the best person to answer that, but it sounds like Mount Sinai has created a curriculum, particularly for the overclassmen, to give you that kind of flexibility to try out to spend some time in other fields. So, it's tough. It's tough to find the time to do that while you're going through school. I mean, focus on school, get through it, learn everything you need to learn to get through school. And then when you're given the opportunities to, I think Ashay said that I think that the school gives you a lot of opportunities to look outside the box.
If you ask for it, they're very supportive.
Yeah. And, I'm finding, because we do a lot of recruiting out of academia, that the career offices are getting more amenable to introducing students to fields other than medicine. And it's even tougher for the graduate schools because they take it very personally, particularly the graduate school preceptors, if you don't follow their path in science. And so, we've connected with a lot of the career offices, for example, I don't remember if it was Cornell or Columbia. It's like that. And it's the graduate school career office. It was new. Like in the last year, they didn't have one before. And so this idea that there's something wrong with somebody who doesn't want to either practice medicine or go into science after their degree, and that somehow that's frowned upon. My sense from the interactions I've had, at least with a lot of the New York institutions, is that culture is waning, and it's not so much the case anymore, and that institutions are doing more to promote other fields, knowing that happier alumni is a happier organization overall.
So the Sinai student that's working with you, she graduated med school, but I guess, did she do a residency or?
She didn't do a residency. So Slavena graduated this past year, and I don't want to tell her personal story, but she knew after third year that she wasn't going to do a residency. So she spent most of fourth year exploring different career paths, figuring out as she was a very creative person. She was part of AMWA, and she led this poetry group within AMWA, and she does a lot of creative writing. And so she had this very creative streak. And again, it was one of those, we provided her the perfect mix where she gets to utilize her creative skills and satisfy those creative needs while still utilizing her MD and doing all this science work. So I think she came to us because the woman who's part of our team is the former pediatrician is still active in AMWA.
Okay.
And Slovena was very active in AMWA. So she knew Sherilyn Shkini, who I'm talking about, part of our team. And so she knew Sherilyn, and Sherilyn introduced Slovena to us, and the rest is history.
So this
is interesting.
Sorry, Alexis.
Sorry. I was just saying, it's just interesting what you're saying about career services and not necessarily being like, an option that people want to show in the past of, because you do feel like once you go to, college, med school, residency, you're kind of on this train unless you actively look for something else. And so I don't remember once during medical school ever even, having something like this where I could talk to someone who actually decided to do something different. But it's interesting because we had you come back, and then also, I don't know if you remember Ricky Gulchin, but she was in our med school class, and she basically has always said that she went to med school because her mom made her go. And as soon as she finished medical school, she got her MFA at Columbia and now is a writer, and like has written a number of well-received published books and that kind of stuff. And so I actually think it's very important to show that you can, like, the medical degree is, yes, I mean, obviously you want to spend your resources training people who want to be doctors, but it's so useful for so many other things. And you have like such a unique perspective and like company. I think it's really cool just to see what you're up to now.
Yeah, thanks. Yeah. Look, the message I was, Monica, one sec. The message I want everyone on the phone or who's going to listen to the recording to go home with is that those typical career paths that you think, right, that the walls, those are great, the ones that I mentioned. There are so many other places you can take advantage of your medical degree besides those typical paths that a lot of people follow. You just have to do some research and investigate. And sometimes it's things not necessarily related to biotech or medicine, where, like creative writing, where you're still going to be able to utilize that education and you're going to be better at doing what you're doing because of that background that you have.
Okay.
You said the website is called Doc Jobs?
Doc Jobs. That sounds interesting. Yeah. So
I'll go take a look at that.
Yeah, go on. It's just every day it's like loads and loads and loads of, and it's just for MDs and PhDs, all the jobs. Yeah.
Sorry, Monica, I'll let you get your comment.
Sure. That's where I come in because I'm the director of career planning services for Mount Sinai. And so do you provide internships, shadowing opportunities? What is the best way to convey your information to current students who are not on this call or who may just meet with me interested in non-traditional pathways, to get them to get in touch with you? What kind of experience can you provide? Perhaps we can collaborate on something down the line.
Absolutely. Yeah, maybe we should take that offline and have a discussion on that specifically, but basically all of the above.
Okay, great.
And we're not super formal, but yeah, and we can be, formal with internships, shadowing, discussions. If you wanted to get a group together who you think might be interested in this space specifically, and we'll, give a little talk more, get into more specifics about what we do on a day-to-day basis, and, bring folks like Savannah to talk about what it looks like, being new, coming right out of medical school and starting the career. Happy to do all of that. Yeah.
Fantastic. Wonderful. Good.
Speaking of
so Monica, just after this is over, just reach out to me. We'll schedule some time to talk.
Great. Excellent.
Actually, we should also get you hooked up with the grad school too.
Yeah, for sure.
Yeah.
Yep.
Because it is a separate office.
Excellent.
Shay, did you have a question?
Oh yeah, I was just saying, speaking of internships and shadowing in any way, are there, for example, during fourth year, there's, and this might be a question for Dr. Dweck as well, during fourth year, I know there's sufficient time to take electives and various different things. Do students typically that might be interested in non-traditional pathways, whether they are pursuing residency or not, do they typically do things like, you know, an 8-week internship and take that as elective time, or is that something that's established?
It's definitely an option that can be explored. You would meet with Dr. Forsyth, Beverly Forsyth, who is the director of electives, to create a tailor-made elective. And there's a form that has to be filled out. But, you know, really the way I look at it, anything is possible if you're tenacious enough, and I can certainly help with that.
Any last questions?
I have a question for Matt. When you were looking for positions on Wall Street, were you only looking at buy side, or were you looking at sell side as well? And did you look at companies focused on healthcare, or apply to like specific healthcare divisions within like buy side or sell side positions?
Well, I actually got recruited by a recruiter who worked for the fund or the institution that I ended up working for. So I wasn't a huge exploratory process, but it ended up just being a perfect fit on a lot of fronts. So yeah.
Awesome, thank you.
Yeah, but look, you know, here's a good way to educate your all. Just go on the DocJob site. I mean, you'll see all the opportunities. Now, a lot of those are banks, hedge funds, VC fund. A lot of it's Wall Street stuff, but the consulting firms are also on there. So, you know, I wouldn't say it's the totality of the opportunities, but you'll get a feel for how many opportunities there are because it's enormous.
All right, well, speaking of social media, Matt, I got to take a picture of you because I have to put it on the Sinai alumni stuff. All right, smile. Thanks. So do you guys have a Facebook presence as well, or no?
I don't run I have like a whole group that does that. Yeah, I'm sure we're Facebook, LinkedIn.
I'm gonna tag you and your company on our alumni thing. So if you want to send me the information later, that's fine.
Yeah, let me ask them how you should actually tag that, because I just don't.
All right. Okay. Anybody else have any other questions at all? No. Thank you so much for taking the time to do this. I know you're really busy.
Yeah. And for anyone on the line or anyone listening to the recording, if anybody wants to talk, I'm happy to anytime. You know, so.
Great. Thank you so much.
Thank you.
You got it. It's been a pleasure. Thanks, and good luck with the rest of your year, guys.
All right. Thank you.
All right. Bye. Thanks, Alexis.
Thank you.
Bye. Thank you.
Bye-bye.